BSI, my scene is safe. I'm responding to a call for we're responding to a call for a 30-year-old male patient experiencing chest pain. It's about 10 a.m. in the morning. I'm gonna call for ALS and update any responding units of the situation as it proceeds. And I'm gonna go ahead and start my primary assessment. So, hey sir, how's it going? I'm an EMT. My name is James. I'm here to help you out today. Could you tell me your name? John? Okay. John, do you know what time of day it is? I know you're experiencing some chest pain, so I just want to make sure we get everything in order. Yeah, it's morning. Okay. Do you know where you're at? Home? Good. And one last question, I just want to make sure your head's working okay. Do you know who the current president of the United States is? Alright, good. And there's no chance you might have fallen or hit your head today, right? You didn't. Okay. You didn't lose consciousness or anything like that? Okay, good. I just wanted to make sure. So my patient is ANO times 4. Alright, sir, so I'm just going to check some things on your body as we go ahead. Just be patient with me. I know this might be a little bit annoying for you. So could you open your mouth? Just say, ah, for me. Okay. Patient's airway appears to be open, clear, and maintained, so I will not be administering an NPA or an OPA, as the patient appears to be self-maintained. I'm going to check my patient's chest for adequate rise and fall and any signs of crepitus or deformity. Palpating the patient's chest. Based on what I'm feeling and seeing, there's no signs of deformity or crepitus. The patient's rise and fall appears to be normal. I'm going to track my patient's respirations. Breathing appears to be adequate at about 75 breaths per minute. I'm going to check my patient's voids. I'm not seeing any blood or other signs of injury behind the patient. I'm also going to check my patient's pulse. Alright, sir, I'm just going to feel your wrists. You don't got to do anything. Patient's pulse appears to be strong and regular. And patient's pupils are dilating regularly, appear to be paral. Okay, sir, so I'm just going to ask you some questions now that we got through that. I just want to ensure that I get all the correct information regarding your own health and what's been going on to make sure we can give you the best possible treatment, either here or at the hospital, when we get you to the doctors, okay? Alright, thank you. So, could you just tell me about what you're doing when you called us and what caused you to call us this morning when you started to experience the pain? You woke up and you just immediately felt chest pain. Okay. And when that happened, did you take anything for it? Maybe aspirin or anything like nitroglycerin? You don't do that? Okay. All right. And in your own words, could you maybe describe the pain you're feeling? It could be pins and needles, sharpness. It could be heavy weight, tightness, whatever it may be. I just gotta get an idea of what you're feeling. A sharp pain in the chest. Okay. Now, does that pain radiate anywhere else in your body, whether it be your neck, your face, arms, legs, literally anywhere at all? Do you feel this pain going or shooting anywhere else? Not yet, not at the moment. Okay, that's good. And regarding this, have you had chest pain or experienced anything like this in the past, in prior instances? Okay. You had a heart-related incident in the 5 years ago. You're 25. Okay. Did that result in a cardiac arrest or anything like that? No, you just went to the hospital for elevated heart rate. Your chest was hurting again in the past. Okay. Well, that's good to know. You have a bit of a history. So, based on that, I'm going to give my patient 4 pills of 84 milligram baby aspirin, which is a total of 324 milligrams of baby aspirin. I'm just going to have my patient chew these pills, and that way I can ensure, we are stopping any potential blood clotting. Sir, so I'm just going to feel your head real quick as well. I just want to make sure you're warm. Okay. Alright, so the patient also appears to be warm, pink, and dry, which is good, which I had missed earlier. And I'm also going to ask about medications. So, sir, do you take any medications or antibiotics? Okay. Do you take anything for your heart? Nothing. Okay. So you don't take medications, you don't take antibiotics. Are you allergic to anything? Did you no? Any? Okay, penicillin. Okay. And I assume you haven't been taking that. All right, good. Now, have you eaten or drank anything today? I know it's still morning. You maybe you did. You just had water before you called us. Okay. And that was what time about was that? It's about 9 a.m. Okay. It's 10 a.m. now. All right. So my patient last oral intake was about an hour ago at 9 a.m. All right, sir. So I'm also just going to check your vitals. I'm going to be checking your blood pressure, your pulse again, just your breathing. I got to make sure everything's working okay, and then we're going to get you into the hospital. All right. I'll be as quick as I can. All right. Thanks for bearing with us here. I'm going to listen to my patient's lung sounds. Should have done 2 times earlier. Lung sounds are bilateral and clear. I'm going to check my patient's blood pressure, so I'm just going to apply the cuff on your left arm, sir. Patient's blood pressure is about 155 over 72. I'm going to feel for respirations. Patient is having adequate rise and fall of the chest. Respirations appear to be at about 76 breaths per minute. Oxygen level is 93%. All right. And I'm going to transport this patient rapidly to the nearest hospital. I'm going to update ALS as we move, and I'm going to be reassessing patient's vitals and level of consciousness every 5 minutes and transport to the hospital before we hand this patient off to the doctor. I will also be taking note of the past chest pain and letting the doctors know of his experience with a heart issue 5 years ago. And I will, and that will be it. So I will call ALS, update responding units, and continue to check vitals. Restating my general impression of the patient, this is a 30-year-old male patient who called this morning experiencing chest pain. Blood pressure was at about 172 over 55. Everything else seems to be working well. Oxygen level is normal. Pulse is strong and regular. There's no signs of deformity or crepitus in the chest. The patient is alert and oriented as of right now, and self-maintaining the airway, so that's why there's no need for an OPA or an NPA. And I will, and that is it for today.